Hi, I'm Susan Taylor with Scripps Health in San Diego, California. According to the National Council on Aging, 1 in 3 adults ages 64 and older falls each year in the U.S. That's about 12 million people. And 6 out of 10 falls actually happen in the home. Those falls result in more than 2.8 million major injuries that actually need to be treated in the emergency room. So how do you keep yourself strong and balanced to reduce the risk of falling as you age? Joining us is Dr. Walter Biffl, Medical Director of Trauma and Acute Care Surgery at Scripps Memorial Hospital in La Jolla, California. Thanks so much for being with us, Doctor.
Hi, Susan. My pleasure.
So why does the risk of falling increase as we get older?
Well, as we get older, I think our minds sometimes outpace our bodies. We tend to lose muscle strength as we get older. We may have a little deficit in our balance. Our vision may not be what it used to be. And while we all want to stay active and should stay active, sometimes it puts us at risk for falling.
And what kind of injuries are we talking about that need to be treated in the emergency department?
Well, the worst injuries, of course, are brain injuries. And we all fall and bump our head now and then. But if you're on any blood thinning medication, that is medication such as aspirin or other antiplatelet agents for coronary stents, medications that might be given for atrial fibrillation to reduce the risk of stroke, or medication to prevent formation of blood clots if you've had a previous DVT or pulmonary embolism, all of those put you at risk for severe brain injury after hitting your head. Other injuries that the older population suffer include rib fractures, and those can be of significant consequence. If patients get fractures, they have more pain and aren't breathing as deeply and are at risk of pneumonia. And of course, as we age, our bones lose strength, and so fractures of any sort are possible after a fall.
So how do we reduce the risk?
Well, there are a number of things that we should do. First of all, our risk assessment is important to discuss with the primary care provider. If you've had a fall in the last year, if you're afraid of falling, these are things you should discuss with the primary care provider. And there are some certain questions that they can ask to evaluate your risk and potentially do some interventions.
And then what about staying active and keeping your muscles stronger?
Yeah, definitely. That's important. And we should stay active. We should exercise. Exercises that focus on strength and balance are the two keys to preventing fall from the exercise standpoint. There are interventions around the house as well. It's important to have a clear path where you normally walk. You don't want light cords on the floor. Anything loose on the floor could be a hazard, a rug that gets bunched up. Slippery floors can be a problem too, so adhesives can be helpful in certain parts of the house. Important to have handrails, in some cases on both sides of the stairway, but handrails in the bathroom, where there are a lot of people we see who fall in the bathroom, and so handrails to help get up off the toilet, or to help in the shower or around the bathtub. Those can be very good for prevention.
And then what about not using your reading glasses when you walk?
Yeah, that's you have to remember that. It can alter the perception, and misstep is pretty easy then.
And then what about medications that people take as they get older and how that might affect your ability to balance?
Medications that prevent hypertension can sometimes lower the blood pressure too much. So if you stand up and feel a little bit lightheaded, that may be a sign that your medication dose ought to be adjusted, or that you need to drink more water or take in more salt. So there are a lot of side effects of medications that can lead to falls.
And then when you talk about the risk assessment with your primary care physician, is this something that you would do at your annual physical, or is this something that you do when you turn 65?
Well, I think it's important at the annual physical because people of all ages are susceptible to falls. The older population where we see the increase in the fall incidence, but it's always something helpful to talk about with the primary care provider.
And with COVID, is it safe to come and see your doctor or go to the emergency department?
Yes, we make it very safe in the hospital and at the doctor's offices. Everybody's wearing masks. There's a lot of attention paid to cleaning all the surfaces and making it safe. The patients are physically separated. The COVID patients are kept separate. So please do not put off visiting the doctor or visiting the hospital for fear of contracting COVID in the healthcare environment.
And then exercises to keep the muscles strong. How often should you exercise, and how long should you exercise per week?
Well, if you can handle it every day, I would say every day, and walking is a great exercise. It's the best one you can do on a daily basis, and it gets you up, it gets your legs stronger, and that's, if you can handle 20 to 30 minutes every day, I think that's a good target.
And what about exercises for balance?
There are a variety of exercises for balance, and I would suggest going on YouTube and looking for videos of things to follow. There are apps that you can get that show exercises for balance and different body areas that you want to focus on. Tai Chi is a good technique that many people use.
And if you do fall, what should trigger you to say, I really need to go to the emergency room?
Well, any significant pain after a fall, a bony deformity, swelling, that should trigger an evaluation because there may be a broken bone. Major cuts ought to be evaluated, especially if the bleeding's not stopping right away. And if you hit your head and you take any kind of blood thinning medications, I'd recommend getting evaluated immediately.
Any final thoughts, Dr. Biffl?
No, I think it's just important to stay active and stay safe.
Thank you so much. We appreciate you taking the time to be with us.
Thanks for having me.
Thanks so much, Doctor. If you'd like more information on how to prevent falling, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media @Scripps Health. I'm Susan Taylor. Thanks so much for joining us.